This is a Starkey 3 series receiver in the canal hearing aid. To properly care for the hearing aid, this is the 2 microphone ports, and this is a rocker switch. What we're going to do in the morning when everything is hard and flaky is turn it upside down, take a clean dry toothbrush and brush it this way and brush it this way. We're going to give it a good brushing. And what that's going to do is make the debris fall out and not in by having it upside down. So then we're going to make sure that these are nice and clear of anything, dust, dander, things like that. Then we're going to look at this side. This is your earbud. We're going to inspect it. This isn't something you have to do every morning. You should look at it every morning, and if it looks fine, go about your day and continue on. If it looks like there's wax and debris on there, then you want to pull it off, wash it in soap and water, run this through it and make sure all the wax comes out. If there's wax on there, just kind of wipe it off and then pull it out. Then we're going to take a look at this. This is your wax guard. This is what stops wax from getting down into your receiver. This is actually your receiver. That's why it's the receiver in the canal. If you clean that, you run the risk of shoving wax and stuff down into the receiver. So we never want to clean it. We just want to remove it and throw it away. But you can inspect it. If it's white and clear, you don't need to remove it. But if it has wax in there, then we need to remove it. And in your kit, you should have gotten a box of hair clears. This is a box of hair clears. And once you open up that box, you will find one of these in there. And then you just twist it, opens up, remove a stick. And then what we're going to do is we're going to take the side with nothing on it. This has the new hair clear on it. This has nothing. We're going to take the side with nothing on it, poke it in there nice and tight, twist it counterclockwise, and pull it out. Now sometimes that doesn't work for me. Let's see if I can leave that behind. So then what I would do is just take my fingernail and pull it out with my fingernail. Either way that works for you is the correct way to do it. We just want to remove that. But if you're going to remove it with your fingernail, remember this is just really thin right there, so you just grab a thin piece. To put a new one in, what we're going to do is pop the new one in, turn it clockwise, and then pull it off to the side. And then I just like to give it a new push to make sure that it seats down properly in your ear, or into the receiver. Then right here we have a shelf. When we put the earbud back on, I like to push it over to the side and push it down to that shelf. And make sure it's down there nice and tight so it's on there good. Now, some people like to have the wax guard poke through, but it's designed to be worn like this without the wax guard poking through. If you like to wear it with the wax guard poking through, just be careful when you're inserting it into your ear canal that it doesn't scratch you. Because it's designed to sit like this so it doesn't scratch you. This is to protect you. So I would recommend that you wear it this way. This is a retention bar that helps hold this into place and hold it still, and I'll get back to that in a minute. So for the battery, this is the inside curve that goes against your ear. So it's the inside curve here. What we're going to do is for this particular model, this is how you open the door. There's a little ridge right here that your fingernail sits into, and you just pull it back and it opens right up. So right here at the inside curve, and you can use your thumbnail or your fingernail, whichever works for you. You open that up. Now the batteries are air activated, so as long as you keep them separated from each other and the sticker has never been removed, they're good up to generally 2 years from the date of manufacture, and there should be a date stamp on packages these days. So once you touch this to another hearing aid battery, even though the stickers are left on them, they're going to start trickle draining. So always leave the sticker on them and never touch them to another battery. Once you're ready to use it, then we remove the sticker. Now the air is in there because it's activated, so you can't put the sticker back on because the air is already in there. We have a flat side, and then we have a nipple side. The nipple side in hearing aids always go down and the flat side goes up. So we're going to put the nipple side down, the flat side up, and I just kind of set it in there. Each model's a little bit different, but it's pretty close to the same thing. Some kits come, all Starkeys, the 3 series, come with this tool that has a little magnet on it. This little magnet will help you. I liked it particularly if I drop it on the floor or something and I can't quite grip it and pick it up, the magnet will grab it for me. But you can use this little magnet to pick it up or put it back in, and then you just slide it off. And then you just close the battery door. Now at night when you go to bed, I want you to remove your hearing aids, and I want you to open the battery door and put it in a case. Dogs, cats, small children, birds, other small animals love to eat hearing aids. So we need to keep them away from them and keep them in a case to keep them safe. So at night you need to do that. But during the day, you'll want to wear them all day long. Now the battery door has a latch right here, so it's part way, so you can close it all the way and then just open it part way. I recommend that you leave it open like this as much as you can at night, because it's going to allow the most moisture to escape. But we do want to have the battery door open to stop the main drain on the battery, and so they don't feed back on each other and make noise all night. You can leave it at this click right here, and that'll be fine, because that way if it turns upside down, you don't have to reinsert the battery in the morning. But if you can, leave it open all the way. If you take a shower with them on, because it does happen, then what I want you to do is I want you to take them off, put them on the counter. Once your hands are nice and dry, pat the hearing aid nice and dry. Once you've patted the hearing aid nice and dry, then I want you to open the battery door, take the battery out, throw it away, and leave it open like this to let the moisture escape. I don't want you to blow on it because your breath has moisture. I don't want you to use a hairdryer because that's too hot and it'll melt the hearing aid. I just want you to leave it open like this until it's nice and dry. Once it's nice and dry, put a fresh battery in it. You should be good to go. If you're not, then give me a call and I'll help you with that. To put them on, what we're going to do is we're going to put that right over your ear. So you just slide it right over your ear. And then we're going to, this will generally hang down right by your ear canal. We're going to pick this up and put it in your ear right there, right here in the bowl. Hoping you can see that good. And then I like to take my fingernail right on the retention bar and just push right here, and that gives me stability. This should be really nice and tight against your skin. That's what we're looking for. If this is hanging up like this, then that's not good. It needs to be nice and tight against your skin. There should not be any gap behind there. If it's nice and tight and fitting properly, it should stay on and you should not have any problems, and it should be nice and comfortable. If it's too tight, then it works its way out. If it's too loose, then it comes out. So it needs to fit correctly. So if you put it in there correctly, you should be good to go all day. When you're ready to take it off, you just pull here and then you lift it over. This is a weak point right here, so we want to not have any torque on there or pull on there. The less is the better, so try not to do that. Just try to grab here, pull it out of your ear, and then over, so you're not pulling it here. If you have any more questions, please feel free to call me. Thank you.